I am Ramesh Babu, retired from BHL as senior manager, and my age is 63 now. And the basic problem I am having is a cardiac problem. In 1999, exactly 22 years back, I had an attack, massive attack, when I was at home. Then I am stabilized at BHL hospital by our doctors. Later I underwent a bypass surgery for my heart. Later I was comfortable for almost 10 to 11 years. And then again in 2011, I had another attack. I was put a stent in one of my grafts, which were done 11 years back that time. So later, in the latest times, from last 6 to 8 months, I am feeling a little inconvenience while walking. And during walking, I am finding some unrest and uneasiness, particularly a small unrest here, sometimes coming and sometimes going. So I thought it is some acidity or maybe some anxiety, some discomfort, maybe because of weather or something like that. I was just thinking all these things even I was sharing with my wife. But one day, during my rest time also, in the afternoon time, when I was about to sleep, lie down, almost 1 hour I suffered with this pain and this sort of unrest. Son-in-law, Dr. Jagdish Kumar, who is a senior physician, senior consultant physician in Medicover hospitals, advised me to shift from BHL to directly to Medicover hospital. Dr. Sharath Reddy, chief cardiologist and one of the directors of Medicover hospital. So he said that he is going to conduct an angiogram and then he will see the position of my heart. Then he will take a decision.
So Ramesh Babu had bypass surgery 20 years before, and later on he had symptoms suggestive of heart pain while doing exertion, for which he underwent angioplasty, 1:1 graft, and also angioplasty to right coronary artery, right side heart blood vessel was attempted, which was occluded by 100%. But that time, they failed in opening that artery. So recently came with acute chest pain, and during which again we diagnosed that a couple of his grafts were again occluded. So we opened those grafts which are responsible for emergency immediately, and we posted him for that right-sided total occlusion angioplasty 15 days later. So these total occlusions are highly technically demanding surgeries, which needs a lot of hardware and operator expertise, as well as a big team support. Since we have been doing these kind of surgeries for last 10 years, and our success rate is beyond 95% in these kind of blockages. So we advised the patient, Ramesh Babu garu, to undergo the CTO PCI surgery, and we completed it in 1.5 hours time using all the technology available with us. Long-standing occlusions are complexity is not for the patient, it is mainly for the operator. So an operator has to study it extensively and devise a plan to open it, and then they have to execute along with their team without any adverse effects on patients. So these surgeries can be done in our country in specialized centers like us with the best success rate, which is equivalent to that of best centers in Europe and Japan. So any such patient having these long-standing occlusions, there's no need to wait for get it treated. So do come, we'll find a solution for you.
So in a very casual and cool way, I did not know that what they are doing. Within 1 hour, 20 minutes or 30 minutes, my RCA, which was clogged 22 years back, was totally open, it seems. Really, it's a very great achievement for my life. For him, it may be a common thing, but for me, it's a great achievement in my life. I am very, very thankful to Medicover hospitals and Dr. Sharath Reddy and his team, and the care the hospital have taken. Everybody helped me a lot to gain back the confidence and have a comfortable life.
Dr. Sharath Reddy sir explained, it's not about the lifespan, but the quality of life will be improved. Then we are very much convinced, and we became very confident, and we went to the procedure, and the procedure went on well as he explained. And what again I should say, in these 3 weeks after the second procedure of CTO, he was walking without any problem in the sense, no complaint about this pulling in the neck or radiating pain or any uneasiness, breathlessness or anything. He never complains, and at a stage he is able to do his own works. Previously, when he wanted to go for his bar, he used to take much time and he used to have an anxious face, whether I may get uneasiness or anything. But now, on these 3 weeks, he was perfectly alright and he is very confident. And in fact, he has improved the way of walking also. He is confident in walking because he is confident that he is not having any pain. So, as he was explaining, we are very grateful to Dr. Sharath Reddy sir and team and to the Medicover hospitals for bringing back once again the natural process of our life, and we are very grateful to Medicover Hospital and Dr. Sharath Reddy sir.